Hi, my name is Dominic, and I'll be presenting the effects of COVID-19 on drug abuse in college students, along with my colleagues Pat and Jess. Background information. Drug abuse amongst college students is unfortunately not out of the ordinary. Plenty of students abuse drugs like alcohol, Adderall, and marijuana to cope with many stressors that come with a difficult semester. Common reasons for drug abuse include coping mechanisms, peer pressure, or to boost academic performance. However, there has been an increase in drug abuse due to the COVID-19 pandemic. It was also found that the rate of overdoses increased. As mentioned before, the common substances abused include opioids, alcohol, stimulants like Adderall, and marijuana. Factors influencing drug abuse. Certain young adults and older adults may be at an increased risk for drug abuse because of their environment or genetics. There's a risk of drug abuse caused by social situations, either from peer pressure or the fear of being in a different social setting. A family member with a history of substance abuse is a risk factor for someone developing a substance abuse. Some organizations may expose individuals to a higher level of substances like alcohol or other drugs and can increase the risk. Something most students can relate to is the feeling of stress, pressure, or failure from academics. The stress, pressure, or failure of academics can lead individuals to abuse certain substances like alcohol, marijuana, or stimulants in an effort to cope or improve academic performance. COVID-19 and mental health. A study was conducted with 2,031 individuals. Of these 2,031 respondents, 1,405 were undergraduate students, 294 were master's students, and 326 were doctoral students. Out of 1,994 respondents, 1,607 experienced some degree of depression. There was, however, a decline in severity of depression as students reached a higher level of education. Out of 2,014 respondents, 1,445 respondents showed some degree of anxiety. Out of the 2,031 respondents, 1,443 noticed an increase in stress or anxiety due to the COVID-19 pandemic, and 1,851 respondents had difficulty concentrating in academics. There was a large portion of respondents that had difficulty adjusting to distance learning, and a large portion of respondents that actually saw an increase in workload due to distance learning.
Drug addiction. What is it? According to the National Institute of Drug Abuse, addiction is defined as a chronic, relapsing disorder characterized by compulsive drug seeking, continued use despite harmful consequences, and long-lasting changes in the brain. It is also classified as a mental illness and a complex brain disorder. The NIDA on drug use versus drug misuse versus drug addiction. Drug use is the use of any illicit drug. Drug misuse is the improper, unhealthy use of the drug or alcohol, and drug addiction is the substance abuse disorder that doesn't allow the person to control their impulses, even with negative consequences.
Listed below are common drugs we found that were abused on college campuses. One of the classes of drugs that are abused are stimulants. Two examples of stimulants are Adderall and Vyvanse. These two drugs are commonly used for academic performance. While studies do show that they do not enhance academic performance, students continue to use them as they believe they help them study longer, study harder, and remember more information. Cocaine is another stimulant that is often abused on college campuses. Contrary to Adderall and Vyvanse, cocaine is used mainly as a party drug in combination with alcohol and other drugs when students party or participate in extracurricular activities. Marijuana, however, is not a stimulant, but it is also abused on college campuses.
Some more common drugs abused on a college campus are oxycodone and Vicodin. Both of these are opioids and are used to treat moderate to severe pain. Some side effects associated with oxy are drowsiness, cardiac failure, and respiratory depression, and some side effects associated with Vicodin are nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness, as well as respiratory depression and coma. One of the most well-known and commonly abused drugs on a college campus is alcohol. Some side effects associated with this are dizziness, aggression, slurred speech, tremor, and liver damage. Another sedative that is commonly abused is Xanax. Xanax is normally used to treat anxiety and panic disorders, but some side effects that go along with this are drowsiness, fatigue, depression, and insomnia. The main difference between opioid versus alcohol withdrawal is that opioid withdrawal is not life-threatening and can be treated at home, whereas alcohol withdrawal requires hospital treatment due to its increased risk of seizure activity. When someone has AUD and continues to drink, their lifespan will decrease about 10 to 15 years. To be diagnosed with alcohol withdrawal, you would need two of more of the following to occur after you have stopped heavy, prolonged drinking. These include sweating, tachycardia, hand tremor, insomnia, hallucinations, mood disturbances, and changes, as well as nervousness. To be diagnosed with opioid withdrawal, you need one or both of the below to occur. So you need termination or reduction in heavy, prolonged opioid use or the administration of an opioid antagonist as an interval of opioid use. And they would also need diagnosed and experience at least 3 of the common symptoms below.
Presented on this slide are 3 types of withdrawal and how to treat them. The first type of withdrawal is alcohol withdrawal. First-line care for alcohol withdrawal is benzodiazepines. Second line is carbamazepine and valproic acid, and supportive care is thiamine and fluids. Benzodiazepine withdrawal requires a long-acting benzodiazepine taper to limit the amount of side effects that patients undergo when experiencing benzodiazepine withdrawal. Opioid withdrawal requires first-line buprenorphine or methadone, or second-line slow-release oral morphine. While the last slide showed supportive care for substance withdrawal treatment, on this slide we will present substance use disorder treatment. The first disorder that we will discuss is alcohol use disorder. First line care for alcohol use disorder is naltrexone, second line is disulfiram, and third supportive care is thiamine. The second disorder we'll discuss is opioid use disorder. First line care for opioid use disorder is methadone and Suboxone. Second line is naltrexone. Non-pharmacological treatment for substance use disorders are cognitive brain therapy, behavioral therapies, self-help groups such as Alcohol Anonymous.
As shown here on the slide, that overdose is not only a concern with young adults, but anyone suffering from drug abuse should seek help. Mental health disorders will increase the odds that students abuse substances in order to cope with the symptoms they're experiencing. So each case is individualized, especially when in regards to college students, and they should prioritize their mental health and seek help. So in part of our research and study, we decided it would be beneficial to interview different college students from all walks of life. These included freshmen to seniors, those involved in organizations, those going to school and working at the same time, as well as different students going for different career paths, as well as degree paths. So as you can read on the slide, their testimonies, most of the students that we interviewed were either exposed or know of people that were around substances that were being abused at one point or another.
After researching COVID-19's effect on drug abuse in different demographics of people across campus, we decided to study how COVID-19's effect on drug abuse affected different majors also. In each of the 3 majors that we found, a senior female pre-med major, a junior male business major, and a senior male STEM major, we all found that they all were affected or knew friends or family members or others that were affected by drug abuse during the COVID-19 pandemic.
UConn Student Health and Wellness does not explicitly address or have a statement about how the pandemic can impact one's mental health and risk of substance abuse. However, if a student is going through drug abuse, they do have resources to help them. Some of these include alcohol and other drug counseling, alcohol EDU for students and parents, as well as there's a diverse group of students and faculty called the Alcohol and Other Drug Collaborative that promote a safe space to prevent harm from substance abuse and really empower students to make the right decisions. They also have different resources to educate yourself on, to read up on as well. Some of them, to name a few, are the Campus Drug Prevention and the CDC. Shaw does address COVID-19 protocols like maintaining 6 feet and wearing a mask, but it still has not mentioned anything about the risks of mental health and substance abuse due to COVID-19.
Listed here is all our works cited for our presentation. We hope you enjoyed our presentation today and learned a little bit more about COVID-19's effect on drug abuse in college students. We would also like to take a moment to share the National Suicide Prevention Lifeline number, which is 800-273-8255. As our presentation dealt with many difficult topics such as addiction, and many students who are addicted to substances deal with depression and anxiety, we feel that it is important to share this number and let everybody know that it is okay to not be okay.